How do you feel personally when you hear that another firefighter has cancer?
It's devastating.
Job-related cancer is likely the number one thing on firefighters' minds other than the job itself right now. There is no doubt about it. It is an epidemic amongst our ranks. I was at the Fallen Firefighter Memorial. In Colorado Springs, we go every year to honor our brothers and sisters who have died in the line of duty. And for about 2 to 3 days prior to the event, I was having pain in my kind of mid to lower back. And then by the Friday, the day before the event, my pain from my lower back had moved from my back down into my groin. And so I was taking a shower when I found a lump. And one of my very deep, close friends, who I've known since Little League, we sat together at the event, and we were sitting there, and I kind of leaned over to him and I said, "Chad, I found a lump today. I'm scared." And so I returned on Sunday and went to the doctor on Monday, and that's when I found out I was in big trouble. And the doc says, "Brian, you have a chance." He said, "But I'm going to have to just about kill you with chemo if you're going to make it." And so I had to go 5 hours a day, 5 days a week for chemo. For 100 days.
I consider it the perfect storm. So firefighters are exposed to multiple different environmental toxins through diesel exhaust and then on the different fires. They're sleep deprived and then there's stress. And so combining all of those factors together, no matter how fit and everything you do, it's very hard to combat the effects of those. So all firefighters should be screened. And so just depending on your risk factors and depending on what I find is the frequency. So if you have a normal exam, I follow you every 3 years for a whole body MRI and every 2 years for the low dose lung CT. Skin exams, I recommend yearly. Prostate exams, if you're 40 and it's normal, probably every 2 years. If we find something abnormal or something, then that's 6 months. So just depending on what we find is the frequency. We started our cancer center in 2017 with my partner, Dr. Pablo Pritchard. And when we started it, we wanted to be different and do a community project. And I happened to be reading about 9/11 and the cancers that the first responders were getting. And I thought, well, I can do this in Arizona. So I called my dear friend, Michael Peterson in Corvia, who works for Councilwoman Laura Pastor. And I told him my interest. And so we started this free cancer screening. And it was mostly lung CTs, some colonoscopies, skin exams, just basics. But fire trucks from all over were driving to come to see me. 3 or 4 weeks into it, I found a really rare cancer in a young Chandler firefighter. And that changed it for me because this man is a picture of health. He was 42 years old, ultra athlete, and it's a really rare cancer. And we found it at stage 1, and it changed everything for him. Then it just spiraled out of there, and more firefighters and more cancers, and now we're up to 170 cancers.
I'm usually the first person that gets the phone call for somebody that has cancer, and I sit down with them and do a detailed overview of the benefits available, the support that they're going to be provided, and we assist them with doing all the legwork and gathering information, taking care of documents, because we want the member as well as the spouse to concentrate on that member's mental health and their cancer care and treatment.
I was doing what I thought was a routine scan that was offered. Thought I was just getting another check mark. Hey, you're good. And I get a call, and I was in a grocery store picking up bread for my son. And I just remember the young lady saying, "And we've seen something."
ultimately, what kind of cancer did you have?
Non-Hodgkin's lymphoma.
Tell me about what led up to you finding out you were in remission. When did you get that news, and how did you feel?
It was this past spring, and I can just remember, Dr. Shuka and, her being, excited, and I just remember, you're good. And I don't know if I heard anything else,
Put off going to Vincere Cancer Center for, the whole time basically. So maybe 4 years, put it off. For me, I'm like, I'm fine. Don't have any issues with absolutely anything. Eat healthy, not much of a drinker. Went in, do the scans, do all the blood work. I did genetic testing. When you get that phone call, we did a second CT the next day. Showed the tumors on the outside of the kidney. It hasn't even went really inside the kidney. It's just attached itself to the outside. Renal cell carcinoma is what they called it. I think the whole situation makes you feel vulnerable. You live a healthy life, and then all of a sudden you have something that can make you sick.
An individual who is suddenly diagnosed with cancer, whether they're young or they're old, unexpected, it's life-changing. They go through a series of psychological effects that most of them have never been familiar with either. So they're not just struggling with the treatment, the modalities and all the chemotherapies and radiation and surgeries that they get from infections, but they're also dealing with a psychological component because they have to face mortality. Whether they're deemed terminal or not, it's in the back of their mind. Is it going to spread? Will it metastasize? All these different effects have a massive effect on their personal well-being, psychologically, as well as their family. So we're not just taking care of the firefighter who has cancer, we're taking care of the wife and the kids and the family, all of the people that have to come together and care for them in their home when they never thought that would happen at that age.